Good afternoon, everyone. I hope you're doing well today. First, let us start with apologies for the inconvenience last week, since we faced some technical problems with Microsoft Teams. Second, we are happy and glad to have you today, and that you could join us today. And hopefully, the presentation will be beneficial and helpful to all of you. So now it's time to present myself. I'm Maria Al-Haj, speech and language pathologist at Hope Habilitation Medical Center. I'm a trilingual speech therapist, so I mainly work with patients in English, Arabic, and French, and I also hold a master's degree in speech therapy. So let us start with our presentation. I would like to inform you that I will be ready to receive and answer all of your questions during the presentation. So as you already know, the presentation today will be about communication disorders in school-aged children, identification and management. Why is this topic very important to be given to the team in schools? Well, it's because you play an important role and a key role in both identifying and managing social communication disorders and other types of communication disorders in the classroom. Well, studies showed that 4 to 5% of children within the same age range can present language disorders and 1% with severe disorders. Let me share with you the screen. Okay, so we'll be proceeding. So, as I was saying, 4 to 5% of children within the same age range can present language disorders, and 1% present severe disorders. In addition, 10% of school students have some sort of communication disorder. So, considering these high percentages, with the fact that early intervention is key, because we know that the brain plasticity is at its peak during childhood, and I personally always compare the brain plasticity in childhood to the sponge. So the child's brain is able to absorb everything, all the stimulation and the information we're providing. So considering these two facts, we should know the importance of the identification of children who may have or be at risk of developing a communication disorder in early school years. And this, in turn, will allow us to provide an early intervention to later school success. How? Through three main things: appropriate interventions, effective management strategies, and special, I would rather use the word appropriate, education. Now, when we say communication disorders, what are communication disorders? We have 4 main types of communication disorders. First, speech sound disorder. Second, child onset fluency disorder, stammering, and we call it sometimes stuttering, so it's the same. Language disorder, and social pragmatic communication disorder. I'll talk briefly about each communication disorder, and I will also be giving you some early signs that you can see in children in the classroom, and those early signs can be considered as red flags. So we'll start with the speech sound disorders. As you can see, it's divided into two two parts. The first one is the articulation disorder, and the second one, it's the phonological disorder. And usually, those two types are confused. Articulation disorder, it's the difficulty in producing individual sounds. So if I ask the child to say or repeat one individual sound, like for example, a b or l, he will not be able to repeat it or say it correctly. So the individual sound does not appear in the child's speech in all contexts and in all situations. Now, concerning the phonological disorder, that is a difficulty combining sounds in the different words, the child does not have any problem with saying or repeating the individual sounds. So, if I ask him to say or repeat, for example, the sounds p or l, he will be able to do it. However, if I ask him to say, for example, the word apple, he might say apple. So he will omit the l. So here the main problem is not with the individual sounds of l and p, but it's with the combination of the sounds within the word. And when we feel or we see that we cannot understand the child's speech, so we have a decrease of speech intelligibility, we might be talking about phonological disorder. Now, concerning the red flags, the red flags are, whenever we see a 3-year-old child who is not intelligible in 75% of the time. Why 75% of the time? Because there will be some words that will still be difficult for him, especially, for example, the long or complex words. 4-year-old child not intelligible approximately 100% of the time. And we should pay attention that the child should be intelligible for individuals other than the parents, because the parents will surely understand what their child is saying. Now, some examples of phonological errors can be cluster reduction, like for example, in the word spot, the child will omit one of the consonants. Reduplication, like for example, wawa for water. Weak syllable deletion, like banana, he will replace it by nana, so he will omit one of the syllables. And we should also know that repetition does not improve the child's productions. Now, the second communication disorder is the child onset fluency disorder, stammering or stuttering. Stammering affects the fluency and the flow of speech. So we can notice that the speech is interrupted by stoppages, repetitions, blocks, and prolongations. I'll take one word as an example. Let's take, for example, the word table. If the child is manifesting repetitions, it will be like t, 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 table. Blocks, it will be like t. And usually the sound is not produced. So we can see, if we look at the child, that the speech muscles are in the appropriate position. So the speech muscles are prepared to produce the sound, but the sound is not produced. And finally, prolongations, like for example, table. And we can have non-speech behaviors associated with speech behaviors, such as muscle tension, and it's usually at the level of the neck, like this. Facial tics, like, and eye contact avoidance. And we should know that stammering is considered among the communication disorders because it only appears when the child is communicating with another person. And we can see that when the child is playing alone, for example, during pretend play, he will not stammer. So it's a communication where we have two persons, communication disorder. We should know that stammering can be part of normal speech and language development, between the age of 2 and 4 years, especially when the child is still developing his language skills, so he's still learning new words, he's thinking about the words, and he's putting all his effort to produce and say long sentences, for example. But we should also be aware of the red flags, like, for example, the time since onset, especially if the child has been stuttering from since 6 months or more. And if he has any kind of speech and language problems associated with the stammering, like language delay, for example, or phonological disorder, and if the child is starting to manifest some emotional difficulties or emotional problems, such as fear, avoidance, so he's not participating in the activities, he's not playing anymore with his age peers. The third type of communication disorders is language disorders. It can be concerning the receptive language. It can concern the expressive language. So receptive, everything the child can understand, so the comprehension of oral language. Expressive, so the expression, what he can say. Or it can be mixed, so it can concern the two, receptive and expressive language. I'll be sharing some red flags for each age range. So if we start with the 3 years old children, some of the red flags are if we have a limited use of speech, if the child is using 2-word sentences only, because usually at 2 years, the child is able to use 2-word sentences. If the speech is not understandable in 75% of the time, as we saw in the last slide, limited understanding of simple questions, difficulty naming objects or pictures, so labeling the things or the objects, and if he's manifesting frustration that is related to communication. So he doesn't like to communicate or to talk with others. 4 years of age, if the child is using 3-word sentences only, and if the speech is not understandable in 100% of the time approximately, if he's taking too long to understand what is being said, if he has difficulty asking questions, and finally, if he has difficulty finding words to express thoughts. And we should also know that these difficulties can be also found in the simple and very basic activities, daily routine activities, such as remembering words, including, for example, everyday ones, likes, the words in songs, so the child cannot repeat the songs or the rhymes, even the days of the week, and his friends' names. Now, at 5 years of age, if the child speaks only in simple sentences, if he does not use grammatical elements like the ed, the past tense, if the speech is not understandable, also in approximately 100% of the time, if he has difficulty with complex directions or double instructions, difficulty telling stories, and difficulty also with peer interactions. Now, if the child is 5 years old or more, we should also be concerned about his reading and writing skills, because we know that oral language is a prerequisite for the written language. If the child has difficulty following complex directions also, if he does not produce complex and long sentences, if he's still producing grammatical errors, if he has difficulty with repeating sentences and the limited vocabulary compared to peers, and finally, if he produces speech with sound errors. Now, we should know that we have some behaviors not necessarily related to speech, but that can also be early signs. And those behaviors are often mistaken for a bad student. Like, for example, if the child gets distracted easily, if he shows difficulties in predicting and inferring or guessing what happened and what will happen next, if he shows disorganized behavior, so we usually say that he's hyper. If he lacks permanence in skills and knowledge, so for example, if we explain to him something today and we ask him about this thing the next day, he will not be able to remember it. So we have a problem with the acquisition and the generalization. And finally, if the child has a slow processing speed, so we can notice that the child is slow compared to his age peers. And if you have any question, I would like to remind you that I'm ready to answer and to receive all your questions during the presentation. Okay, so now we'll proceed with the social pragmatic communication disorder. I will be sharing with you a short video talking about this topic, and then we'll proceed with our presentation. Okay, I just need 1 minute. Mm-hmm. Okay, I'll just stop the video now and I'll proceed with the presentation. Okay. Just give me a few seconds. Okay. So, I would like to highlight a very important information. It's that social pragmatic communication disorder is different. It's very different from language disorder. And usually we receive parents in our clinic coming with the main reason for referral, that is language delay. And even before starting with the assessment, we can see that, no, it's not only language delay. We can see some difficulties or a delay in the communication also. We'll be seeing in the next slide some of the early signs or symptoms for the social pragmatic communication disorder. So now that you saw the video, you can also relate. So some of the red flags or early signs are difficulty in interacting with teachers, friends, and other people around them. And this is why it's called social communication, because we have difficulties in the interaction with others. We have also reduced eye contact. So the parents usually explain that the child is not making any eye contact with them because he's not paying attention. Whereas no, it's not related to the attention or to any attention deficit. It's because he might have a communication disorder, a lack of response to name. So if we call him, even if we call him several times, he will not be able to respond to his name. Difficulty engaging in a group, difficulty in following instructions and rules, and poor understanding of emotions. Not only understanding emotions, but also expressing feelings and emotions. And it can impact the development of speech, but it's very different from the language delay. Now we're done with the identification part, and we'll proceed with the management part of communication disorders in school-aged children. So as we said, detection starts in the classroom, so in the school. The next step to do is informing parents. Of course, every school has its own procedure, but I believe that informing parents is one of the main goals for everyone. And we should pay attention that while informing parents about the symptoms or early signs, we should not say the name of the diagnosis. Okay, because it's the speech therapist. It's the speech therapist's role after the assessment to give the diagnosis. So without naming the communication disorders, like for example, it's stammering or it's social pragmatic communication disorder, you can only, if you want, describe the symptoms or signs. And then when the parents will come to see the speech therapist, she will do the necessary assessment and evaluation, and then she will be able to fix a diagnosis. And sometimes, often speech therapists take too long, like for example 6 months before confirming any speech therapy diagnosis. You can help us also in the assessment in an indirect way. How? You can, for example, use some of the checklists that you can find easily on the internet, for example. I'll be sharing now with you this checklist, Strengths and Abilities Communication Checklist, because you know that you can provide us with information that we cannot obtain in our sessions, in our one-to-one sessions, like for example, the social connections or the communication skills. As you can see here, for example, we have questions about the play skills. Okay, so for example here, the child prefers to play alone or prefers small groups or larger groups. And if he knows how to join a group or other children engaged already in an activity. So those skills speech therapists cannot obtain in the sessions, in the one-to-one sessions. So you also play a key role here in the reason for referral. So I will not go into details for the management of each communication disorder because after doing the assessment with the speech therapist, she will be providing the school with the important adaptations and tips for the teachers because it's very different from one child to another. But I'll be sharing with you some quick tips, like 3 or 4 quick tips for each communication disorder. We'll start with the difficulties with receptive language. So we can encourage the child to repeat back instructions to ensure that they have understood you. Use a clear visual support such as gesture or pictures when giving them information. Give one instruction or ask one question at a time instead of double instructions, and use closed rather than open-ended questions. Like, for example, instead of asking the child, what did you do yesterday? We can ask him, did you play with your sister, or did you just sleep early? So those are closed-ended questions with options or choices. Now, for the difficulties with expressive language, we can model language and give the child time to imitate us, but without asking him or her to say or repeat. So this is a common thing I notice and I see everywhere. We always ask the child to say after us or repeat. Like, for example, say, I want to eat so that I can give you the chocolate. Or repeat after me, open the door. Because if we keep on doing this, we would be promoting robotic behavior, because we should know that communication and interaction should be spontaneous. Now, the second tip is expanding and adding words to the child's sentence. For example, if the child will say pizza, I can tell him, oh, you want to eat pizza. And I can wait for him to imitate or repeat after me spontaneously. And the third tip is to offer choices. So we can start with offering 2 options, and we should name the objects while presenting them. And the most important thing is to give the child time also to make the choice. Now, for the stammering or disfluencies, we have to speak slowly as a model for the child. We should pay attention. It's also a thing that we always see. We should never offer suggestions such as slow down, or can you say that more clearly, or please can you repeat but breathe first, because it's not a breathing problem and the child cannot control the disfluencies. And if we will do so, he might this might increase the disfluencies. So he will start to stutter more. And finally, we have to reduce time pressure, and if we can avoid time tasks. Okay, I'll be sharing now with you a tool that you can use in the classroom. It's the Daily Fluency Tracker, and you will also help us, speech therapists, because you can inform us about the time of the day when the child is stammering, and if he will be aware of the disfluencies and what was his reaction when disfluencies appeared. Okay, so we can also learn more about the progress of the stammering, how it's progressing. Okay. Now, For the social pragmatic communication disorder, some quick tips are, while talking to the child, come down to his eye level and make eye contact with him. So if he's not available, don't talk to him. Just come down, make eye contact before communicating. Use visual support to promote better understanding and help them understand and express their feelings. Also, you can use visual support. So as you can notice, visual support is very important. I'll share also with you now some tools that can be used. If you can see, the student self-monitoring form. So we have here a target and we have squares, like 5 squares next to the target one. The most important thing to do here is to fix a target with the child. So we should never fix a target for the child without involving him. Or else he will not be motivated and he will not try to do his best to achieve the goal or the target. Some examples, like I can leave my seat up to 3 times during math lesson. Or I can ask 5 questions during math time today. Those are just examples. Okay, and if you can see, we can also use this monitoring form for behavioral issues. Okay, now you can see on the screen a kind of visual support. This can help a lot children with expressive and receptive language problems or difficulties, and especially with social communication disorder, because as you, if you can remember, we said that children with social communication disorder cannot or have difficulties with expressing their feelings and emotions. So it can reduce, so using these visual supports can decrease the level of frustration. Also, you can see basic needs and basic rules. Okay, like for example, toilet, or I need to stand up, or you need to listen, or stop, quiet. And finally, we have the daily schedule. I'm sure that in the classroom, teachers usually use a daily schedule. So this is the daily routine. But I would also suggest that we do an extra one for the child with difficulties, and we can put it, for example, next to him. We can laminate it. We can laminate the paper because we'll be maybe using a marker that can be erased. And every time you will finish a task, the child will take the marker and he will cross out the target picture. So this will provide a better understanding and will then in turn reduce the level of frustration, because it will help him predict what will be coming next. Thank you for joining and thank you for listening. I hope that this presentation was beneficial and useful to all of you, and I'm now ready to answer all of your questions. So I'll be waiting. If you have any question concerning anything. And you can use the link for the questions on the right. There is a link. Okay, so I have a question. So does language most likely mean autism? Okay. So I'm not sure if you mean social communication disorder or language, because language delay or language disorder is very different from autism. So we can have a language delay because the child needs some stimulation, for example. So we'll start working with him, and then he will be able to talk like his age peers. So language delay or language disorders are very different from autism. Now, for the social communication or social pragmatic communication disorder, usually when we explain to the parents that the speech therapy diagnosis is social communication disorder, they will directly ask us, oh, so it's autism, because we have some common symptoms like the eye contact, the reduced eye contact, the child cannot respond to his name, but we should know that it's different. So in autism, children have social communication disorder, but not every child having the social communication disorder is autistic or has autism. So it's different, okay, because also in autism, we have many other symptoms and criteria other than the social communication disorder, like, for example, repetitive behaviors or restricted behaviors. And if the child has only social communication disorder, not autism, he will not probably have repetitive or restricted behaviors. This is an example. And I would also add that a speech therapist cannot diagnose autism. We can only say that this child has a social or pragmatic communication disorder, but it's not us who can diagnose autism. Now, I have a student who is stammering. Parents have been to a speech therapist already, but he had stopped for a while, but he has started again. Yes, well, one of the characteristics of stammering is that it's fluctuant. So sometimes it can disappear. Like, for example, today it can disappear, and then the next day it will appear. So this is one of the characteristics, but we should always know that if the child has been stuttering since 6 months or more, and for example, he suddenly stops stammering, we should not be sure that, okay, so he's okay now, we should stop speech therapy, because as I said, it's one of the characteristics, and we should always be aware of the red flags I shared with you previously in the slide. Okay. When a child is mid-stammering, how best to help them? Okay, so as I already said, I gave you quick tips. So we should always speak to him slowly. So we should reduce the speed of our speech because it will be like a model for him. Then we should never ask him to repeat or to breathe or why are you talking like this? Can you repeat it one more time, please? Because it will increase the stammering. And usually, if the child is working with a speech therapist, then the speech therapist, after the assessment, will also maybe will be providing maybe the school or the teachers and the parents with the appropriate technique, because we usually use some specific strategies and techniques other than the recommendations and tips that we give. So we can also teach the teachers and the parents about the technique, how to use it with the child. Okay, is autism spectrum disorder a social pragmatic communication disorder? So I think that it was before I answered a similar question. So as I said, it's different. Not every child with social communication disorder, autistic or has autism, but usually all children with ASD have a kind of social communication or pragmatic communication disorder. Okay, what about as a second language? I know it's not a disorder, but it might be confusing to identify during early years, and it might be confused with a speech disorder. Okay, it's a very interesting question since we live in a bilingual or trilingual country. So we should know that children are born with the skills and with the ability to learn more than one language at the same time. Okay, so it will not cause, so bilingualism will not cause language delay. And to answer more specifically to your question, usually we see the first language. And if in the first language the child does not have any problem or any delay or difficulties in the first language, and if the difficulties are only present in the second language, it's not language delay nor language disorder. Okay, so we should always refer to the first language. Okay, another question. Okay, it is advisable to teach multiple languages to children having speech problems. Okay, so as I said, children are born with the ability to learn and to acquire more than one language at the same time. But now, if we have children having speech problems, we know that, especially here in this country, we're called to work, for example, in the nurseries or in the schools with children. For example, at home, they are communicating and talking with their parents in another language, in their mother tongue, and at school in English language. And we cannot do a lot of things about it, but there are some recommendations that we can give to the parents, okay, and to the teachers. Like, for example, at school, if we start talking to the child in one language, like for example, if we're saying anything, if we're telling a story, it's better to not mix two languages in the same sentence. Okay, so if I started now talking in English, so I should continue my information or my sentence in the same language. But a bilingualism will never cause a language delay. Okay, so for social problems, is speech or ABA best suited? Okay, so, well, if we're talking about social problems or social communication, so as the terminology says or shows, it's social communication, okay? And in ABA, of course, we have many benefits and they will be working on different goals, but I would personally advise to start with speech therapy, because in the speech therapy sessions, we will be mainly focusing and targeting the communication part, okay, the interaction also, because sometimes ABA will promote in some kind the robotic behavior, especially for the social, especially for children with social and pragmatic communication disorder. So maybe we can start with a speech therapy, and sometimes the speech therapist will advise for ABA. It depends on the assessment and on the case, and of course on the child's needs. Okay. Will the child grow out of the social disorder after a certain age? Okay. So, well, when we talk about disorders, we cannot be sure that the child can outgrow the problem. That's why when we first start with a child, okay, as a speech therapist, I always use the word delay before disorder. So for example, if I'm seeing now a child with symptoms of social pragmatic communication disorder, I'll just write down in the conclusion of my report that the diagnosis is social communication delay, not disorder. And then we will start working with the child, and with time we will be able to precise if it was only a delay because, for example, of a lack of stimulation or any other reason. And if, like, for example, after 6 months, we cannot see a lot of progress, then we might be going more into a disorder. And usually, children diagnosed with social pragmatic communication disorder cannot outgrow the problem completely. It depends on the severity, on the age, okay, and on many other factors. Okay, can you tell a child has a disorder at 2 years? No, it's still too early. Okay, we should wait, and especially if the child didn't do any speech therapy before. So we cannot directly say that a child has a disorder. We should wait And we should not only considering the age, but also considering the fact that he didn't do any therapy before. Okay, how do you support a child who refers to herself in the third person and does not take responsibility of her actions? We should see, is it the only main problem that the child is referring to his or herself with the third person, or is it one of the symptoms for a bigger language delay? We should see this. Okay, I will continue with the questions. Is it genetic? Because I have a student having difficulty in speech and the younger siblings is worse than him. I would say it's a risk factor. Yes, it's a risk factor, but it's not always the case. But it can be a risk factor because sometimes we can have even twin brothers, for example, or twin brother and sister, and one of them has a language disorder or language delay and the other no. So it can be a risk factor, but it's not always the reason. I have a child who only says out one syllable in a word, but is able to use gestures to show understanding. Which disorder is this, and how do I encourage him without asking him to repeat after me? He is near years old, for example. Okay. So for carrot, he will only say ka. Miss, he will only say me. So here, if you remember, I gave some of these examples in the slide where I was talking about the phonological disorder. Okay, so the child has difficulties combining the sounds in words to form a word that we can understand. So we have a decrease of intelligibility. I believe that because you're his teacher, you can understand now what he's saying or what he's stating. But some of the adaptations you can use is that giving him a feedback. Okay, so giving him the right word. For example, if he will say ka, you will just come down at his eye level, make eye contact with him, and just give him the correct or the right word. Like, for example, carrot, okay? And just wait for him to repeat. You can also divide the words into syllables, like, for example, carrot or miss. You can give also gestural cues, like, for example, this, like the snake. If he's saying me instead of miss, you can just say me. Okay, those are some adaptations or tips you can use. You can also exaggerate on the sound that is wrongly produced. Like, for example, sun, if he will say ton, you will just say sun. Okay, another question. Okay. So if a child drops the s sound for swimming and says swimming instead, how can we help? So I just also answered to this question. So you can use the gestural cues. You can divide the word into syllables and exaggerate the pronunciation or the articulation of the target sound. Okay, but if the child has an articulation problem with the, or articulation disorder with this individual sound, so you will be trying with these tips or recommendations, but if he cannot say the individual sound, so you can do a lot about it. He will probably need a speech therapist, but it depends on his age also. Okay. How can we help a child with a stammering problem to cope with peer teasing, mainly in small classes? Okay, so here I think that teachers play an important role in sharing awareness, even with children. So you can, for example, do an awareness session without pointing at the child, of course. Okay, so it would be a great idea. Like today, I prepared for you a presentation. We will talk about children, and you can start exposing the differences between children. And you can, for example, use one example that I usually use a lot in the therapy. You can, for example, explain that like, for example, we have some people wearing hearing aids. We also have some people or children wearing eyeglasses to see better. We also have some children that need some help to speak or to talk in a better way. Okay, so let's start with a presentation, awareness presentation for the children. And then you can make sure that the children you will choose to participate or to work with this child are accepting this child, okay? And finally, you can apply all the strategies and the tips I gave you in the presentation. Okay, like for example, reduce the time pressure. So avoid timed activities. And one other thing, it would be good to avoid also competition. Okay, so tasks involving competition between peers. Okay, if as a teacher I am unable to understand what a child says, how do I get them to repeat what he says without asking him to repeat? What else can I say? Okay, so you can try to guess by giving him options or choices. Like, for example, if he's saying lit, you will come and say, do you mean light or chocolate? Okay, so you will give him options and he will try to repeat if it's one of the options you gave him. You can also try to ask him to show you, and after showing you the thing he wants, you will give him the right word, and you will be using also, if you can, the strategies like dividing the words into syllables or just repeating the word and giving him time to repeat it after you. Okay, another question. Okay, could you give an example as to how the visual cards can be used by the child? For example, well done. Yes, in fact, those visual supports can be used with children with receptive or expressive, but uh, the way you ask the question, I think it's more for the receptive language problems. So, for example, if the child cannot understand that he did something good, you will just show him the card, well done, and he will associate the picture or the card to the idea of well done. So he will start understanding that whenever the miss or the teacher will show me this card means that I did a good job. And with time, you will try to remove the visual support, and the child will be able to understand the meaning of the sentence. For pragmatic disorders, do you have to work in groups now that you have social distancing precautions? Yes, we used to work in groups because it's very important, because as you know, it's a communication disorder, and when we were talking about communication, so this involves many persons, not only one person. But unfortunately, we cannot work in groups now, but we're working with the child in one-to-one sessions, because those one-to-one sessions are very important, and especially at the beginning of the therapy, we mainly focus on those one-to-one sessions. So the therapist and the child, because we'll be working on skills such as nonverbal communication skills, eye contact, joint attention, the imitation of actions, understanding and expressing of emotions, feelings. And then in the groups, we will be working on the generalization of those skills. So even if we're not working in groups, it's very important to start with the one-to-one sessions. Is 2 years and 10 months too early to suspect articulation disorder? All children can speak clearly. The child understands perfectly, but I can't understand mostly everything the child says. Okay, so as I said during the presentation, we have a difference between articulation disorder and the phonological disorder. So we should know that articulation disorder is the difficulty in producing individual sounds. So like, for example, once one individual sound is not produced correctly, like b, it doesn't appear, it never appears in the child's speech, or is it phonological disorder? So he's not able to combine correctly or in a correct way the sounds in the words. Okay. Another question. How do you help a bilingual child who is fluent in one language but mumbles the other unintelligibly? Okay, so we should always see and make sure that he doesn't have any language difficulties or delay in the mother tongue, so in the first language. And if it's the case, and if he only has difficulties with the second language, then we should advise the parents to do some activities with him at home, okay? Because we will not be talking about language delay in this case. So if there's no problem in the mother tongue, so we'll be more giving exercises, practicing the second language. okay? Because it will be the weak language. For a child with language disorder and also autism, for 6 years old child, what could be done? Okay, so I think that if he's 6 years old already, and if we already have a medical and speech therapy diagnosis, the child, I believe he should be doing the necessary therapies, right? So it depends. It depends on the on his needs. And usually the speech therapist, after assessing the child and working with him for a while, will be providing the school and the teachers with the necessary adaptations and tips, because every child is really different, especially when we're talking about a child, a 6 years old child. Okay, so you should. I suggest that you collaborate with the speech therapist, with his speech therapist, because she will be able to give you specific adaptations and recommendations for this child. But you can always use the visual supports and all the tips I shared with you. Okay, so I believe there's no more questions. Okay. So, thank you for joining us. It was a pleasure presenting today to all of you, and I hope that the presentation was beneficial to you. And thank you again for joining us.